Going. We are going to go ahead and get started. Today is June 24th, 2021. If you're watching a recording of this, some of this might be a little out of date, so be sure to check cdc.gov or contact us at TAPI for any updates to schedules and things like that. And we want to start by just saying we know that many of you, especially our partners in Northern Arizona, are in communities that are really being severely impacted by wildfires. Our hearts are with all of you, and we are trying to do our part by staying away from your beautiful parts of the state. We just want to let you know our spirits are with you, and just all of the good vibes we can send to you as you support your communities. So my name is Rebecca Nevedale, and I'm with TAPI, and I am here today with Macrina Leach. Macrina, do you want to say hi? Hi, everybody. She waved, but remember next time you talk to unmute yourself, Macrina. So you want to practice?
I'm unmuted. Hi, everybody.
Hi. This is our second tips training of the year. We were all together 2 weeks ago, and we're going to spend just like 2 minutes going over what we reviewed at the last training, because we know quite a few of you weren't on there. So we started 2 weeks ago with talking about like the basics of why we immunize when we do. So the reason why we immunize is because we are trying to achieve herd immunity. So what herd immunity is when a portion of the population is immune from a disease, then that disease can't penetrate the community. It can't go in there and spread because people are either have already had the disease and can't get sick again, or because they were vaccinated against the disease, so they can't get that disease. That's what herd immunity is, and that's why we vaccinate. So every disease has a different threshold. So it's a percentage of the population that needs to be immune in order for us to achieve herd immunity. So for measles, we need 95% of the population immune from the disease so that measles doesn't come into that community. For influenza, we only need 33 to 44% of our population immune from the disease so that the disease can't really impact our communities. So that was not supposed to happen. Oh, I clicked on the reference. That's the reference. Let me start again. There we are. Sorry about that. It's still doing it. All right, always technical difficulties. It's our second one, but I think I know how to do it. I'll use my arrow instead. All right, well, while I figure out my thing, I'd love it if some of you can kind of check, those of you who were on there last time, on our tip session last time, why don't you chat in what your kind of key takeaways were from last week? So anything that really you remember from 2 weeks ago when we met, that you want to make sure people who weren't able to participate in the session, that they remember. So if you could start chatting that stuff in. And I think I'm back on action. You see my slides now, not the data, right, Macrina? Okay, perfect. All right. So that's what herd immunity is. That's why it's so important, because we want to make sure diseases can't get into our community. And we do have a way to improve. So on our TAPI website, you can watch the recording if you want, but we also have lots of links to how we're doing in Arizona in terms of our immunization coverage level. So how close we are to herd immunity. We have some room to improve, but we're pretty certain that we will get there. And Dominique's in the chat is saying she's pretty shocked at how many parts of Arizona have not achieved herd immunity, and that anti-vax culture is scary. So everything that contributes to us not having those high immunization coverage rates is scary, right? So there is a lot of work that we have to do, but we are going to get there. And the best part about tips is that we get to thank you for all you do, because you are truly the protectors of herd immunity. There are a lot of us that work in public health and in social services that talk to the families that we interact with about the importance of immunizations, but you are the ones who actually put shots in arms. So herd immunity is truly on your shoulders. Immunization coverage rates are also truly on your shoulders. And we really thank you for that. And we know it's a hard and pretty thankless job. And many of you walked in today at 8 a.m. and your provider was already 30 minutes behind their schedule. And you walked into an exam room and there's Mrs. Carter with 4 of her kids sniffling and sneezing. And you know she only has an appointment for that one kid. And you are walking out, your hands on the door. And she says, well, before you go, I have some questions before I talk to the doctor. And you turn around and take a breath and listen to her concerns and help empower her to ask those questions of her provider so that you can go right back in that room, maybe today or maybe next year at the next scheduled well visit, and immunize that child and save their lives. It's saving a lot of lives every vaccine that you give. Look at all the diseases, Macrina, that they prevent.
Yeah, I think this is really the coolest thing. When you think about all those immunizations you give and all the work it is, and explaining to the parent how to hold a child and why they need all these vaccines, these are a lot of vaccines out there. And in your lifetime, we have added a new one, COVID-19, which is now we're looking at as a routine immunization for children 12 years of age and older.
Yeah. Yeah, and there's really not very many, a better example than COVID-19. I think for us to think about the importance of immunizations right now, because we're really living through it right now, how immunizations can really impact rates. So
I think for all the time you hear, why do we need to immunize against it? We don't see the disease anymore. I think this is really a good example of, well, we stop immunizing, we are going to see it back. And this is where.
What is the starting rate of medical assistance here? Because there again, there again depends on your years.
there we go. Okay, thank you. Okay, second best part of tips, we get to give out prizes. So we sent an evaluation after the last session, and everyone who completed that evaluation has been entered into our grand prize drawing of the day, which is a $50 gift card, which is a lot of money. So I'm going to spin our wheel and we'll see who our winner is. Selena Ketterling wins $50 gift card. So Selena, private chat me your address. Oh, Erica, big money, no whammies. Private chat me your address so that we can mail you your $50 gift card. And I'm gonna spin the wheel again because I like giving out prizes.
You just like spinning your wheel.
Oh, it's a fun wheel. Okay, Natalie Ariola gets a t-shirt, a Tappy t-shirt. So make sure you private chat me your address too. And I'm gonna do one more we're getting these new prizes this year that are children's books about vaccines. So one more spin. Oh, you don't get to win twice. Okay, Michelle Dick, you get the children's book. So make sure you fill out the evaluations next time so that you too can get a prize. And if your name was already drawn, then private chat me your address so we can mail them to you. And yeah, hooray. And there's the t-shirts and there's the books. So we're going to be doing lots of drawings. You know, we always give away prizes. So when we do tips and purpose, we tend to just kind of throw things into the audience. So this is our way of throwing things. So we are going to go over vaccine basics today. We're going to talk about the ACIP schedule. we are going to do a little demo on reminder recall, how to use ACEs to do your reminder recall systems. So that's our topic today. Why do we immunize? I mean, we talked about this a lot 2 weeks ago too. So we won't talk too much now, but we immunize to prevent diseases, get herd immunity, and protect our most vulnerable. These diseases that you immunize against every day used to devastate millions. Before measles vaccine in 1963, we had 3 million cases of measles every year just in the United States. We had 21,000 kids paralyzed from polio in the year 1952 alone. It really is critical in reducing disease. And like we were just saying, COVID is our living, breathing example. So every day the state submits data to the CDC on how many COVID cases that we have. So last year, or this week last year, our 7-day moving average was 2,555 cases. That was how many cases, you know, if you average out the 7 days around June 22nd, that's how many cases there were. We like using that number because, you know, on some Sundays, people don't really get tested. So it looks really low on Sundays. Christmas Day, no one went and got tested. So that week, if you would have pulled the data from that day, it would have looked like no one had COVID. So that 7-day moving average just kind of helps address that variation. In December, before the real, you know, peaks that we all experienced, our average was 6,122 cases. So December 22nd, Macrina, when did you start immunizing against COVID?
December 18th was the day of our first 2 pods.
Okay. And remember that, so in December and early January, we were only immunizing you all. We were only immunizing people who worked in healthcare centers. So in health clinics, hospitals, people, you know, we weren't into the general population until later in January, February, and March. But during this time, when we start seeing that decrease in cases, that's when we started really getting vaccine out there. And today, our 7-day moving average is 423 cases. Now that'll go up a little bit because the data backfills and, you know, there's all these reasons why, but the vaccine's working. It's getting our cases down. And if our cases are down, then our deaths will be able to go down. So we're going to talk about the schedule. We're going to talk about vaccine basics, but let's think about how does our immune system work? And I probably forgot to select share sound, so I'll do that.
Immunity is a natural defense system of the human body. Imagine millions of immune cells, like white blood cells, all on the lookout for specific germs. If they spot something dangerous, like flu, they prepare to fight. When that flu bug enters your body, the white blood cells move in on it. The immune cells arm themselves and then replicate, creating an army of clones. Then they launch powerful germ-killing agents called antibodies, and they tag the germs for disposal. Once the germ is removed, the immune army can disband. But they leave behind memory cells. Their job is to remember the invader and to sound the alarm if it ever appears again. The first time around, it can take at least a week to mount the defense. But next time, the system is prepared. The whole process takes barely a day. It's so fast, we may never have time to even feel sick. A vaccine pre-arms the immune system by sending in a weakened or dead version of the germ, just enough to be recognized. The immune cells mount the defense, and again, you may feel the effect. But because the threat is low, the immune cells quickly disband. However, the all-important memory cells have been created. The immune system's now prepared for the real germ, but without causing full-scale disease.
All right, so that is how our immune system works. We always find those reminders are good for any group, even those of you that are working with this every single day and explaining it. So types of immunity, we've already talked about herd immunity. So Macrina, tell us what passive immunity is.
So passive immunity is what you get. It either goes from mother to infant. That's why we give Tdap in the 3rd trimester of every pregnancy, is because that baby's born with a little passive immunity to pertussis. If you receive whole blood or immune globulin or any blood product, you usually get a little bit of immunity from that person who donated the blood. The issue with passive is that it's pretty temporary. It doesn't last that long. So it's good for the short term. Well, and then active immunity, that can be a little bit more harder for you to have to handle because it's either natural disease, and who wants to go through that? But it's usually long lasting. So if you suffer through a disease and you're lucky enough to recover completely without any side effects and survive, then you get sometimes long lasting immunity. Immunization is actually the easiest way to do it because you just go in, get the vaccine, and your body does all the other work.
And there's lots of different types of vaccines. So just, scientists look at how does your body respond to a particular germ, and then what technology should they use when creating a vaccine in order to get your body to have that response so that you can create those memory cells with their binoculars running around in your body. So I think a different way to think about vaccine types, we say vaccine types, but really this is the technology that's used to create the vaccine to get that response.
Right.
I'm going to go over all of them kind of briefly, but this is a popular one. Lots of vaccines are live.
So there's live attenuated vaccines, and it's just a weakened form of the virus is what it is. It cannot cause disease. Routinely, what it does, though, is a lot of the immune response, or like some people like to call it reactions you might have, are similar to that of natural disease. They usually produce lifelong immunity, and it's usually 1 or 2 doses. Now, why we give 2 doses of, let's say, MMR or chickenpox is not because the first dose doesn't work. It's just because 5% of the population may not get immunity from the first dose. So we give everyone a second dose just to produce immunity in those 5% that did not get protection from it.
And these are our live vaccines: chickenpox, smallpox, yellow fever, MMR.
And then we have inactivated vaccines, and they don't replicate in the body. You just inject an inactivated, a killed version of the germ. It's unaffected by any antibodies or anything in your system. So that's why if you've donated blood, or you can go ahead and get an inactivated vaccine anytime. Some of the negatives is that you can take 3 to 4 doses, and routinely you need boosters to continue to remain immune. And these are your inactivateds. Okay, messenger RNA, that is been talked a lot about because that's currently what 2 of our COVID vaccines are, messenger RNA. And they've been studying this technology for a very long time, for years and years and years, actually decades. But they never really had an opportunity or the need to actually use this technology to make a vaccine that the entire population needed. And all it does is it sends in a messenger that makes the protein in order to trigger the immune response. The good thing about these vaccines is they can be made very quickly. And the other is that they can also be tweaked. So if we see a variant that the current vaccine isn't really effective against, they're going to be able to tweak this vaccine very quickly and get it back on the market and out on the streets.
So there's a couple questions coming in about the live. There we go. So I just want you to look at this and see if these are correct for me. So,
This is correct. Chickenpox, yellow fever, MMR, smallpox, and rotavirus are live.
okay.
HPV is not live. It is actually an inactivated vaccine now. Used to be a live vaccine, but now it's inactivated.
Okay. Oops. So Hep A, polio, and flu are inactivated. Okay.
Correct.
All right, good. And then I want to know, and I have a prize if someone can be brave enough to unmute themselves, but what kinds of questions are you all hearing about mRNA vaccines? So you can chat it in or unmute and tell us, but.
That it stays with you and changes your DNA. That's what everybody's worried about.
They're all worried that. So Mark Pyle gets a t-shirt. So tell me make sure you chat me your address. But Macrina, what do you say to that?
That it cannot, that just because this is the first vaccine that has been developed and widely distributed and used, doesn't mean that this has not been studied. So this has been studied. It cannot change today. It cannot change who you are. It's just a way to send in that spike protein so that your body can recognize it and build an immune response. I think a lot of people think that this is brand new technology. It's not new technology. They just found a use for it.
Will I get mRNA if I get vaccinated? So that people just don't understand what mRNA is. Sounds like, if that's the question they're getting.
Right. mRNA is a technique, not a thing.
Yeah.
But people are against the mRNA vaccine because they feel like it may affect their sterility. So you're seeing the younger population not so interested in getting the vaccine.
So there was at first some concern that the mRNA was close in type to the DNA that was found in the uterus, but close is not the same. It's different. You look at all of our cells and everybody's DNA. They're close, but they're different, and different is different. And so I think that's kind of how to explain it.
Yeah, I wonder if it would be helpful when you all take the evaluation, which I know more of you will now that you know you could get $50. Put in what those specific things that you're hearing about COVID. And I don't know if because maybe in 2 weeks we're going to talk about talking.
It has a tracker in it.
And that, yeah, that it has a tracker. I know that keeps.
What kinds of questions are you getting about mRNA?
And the metals but if you put those things on the evaluation, then we can make sure we address all of those actually in 1 month. Next week, we're going to talk about storage and handling, and the week after it's going to be talking to patients, but. Okay, so let's get back to different types. This is another bunch of types.
SUBUNIT, RecomBINANT, POLYSACCHARIDE, CONJUGATE. It's just a way for them to get a specific piece of the germ into your system so then your immune system can build an immune response and recognize the live virus or germ when it sees it. And they usually use a protein, a sugar, a capsid, something like that. For example, pneumococcal is both polysaccharide and conjugated. They have 2 forms of that vaccine. One that works in younger children and one that does not work in younger children. Yep.
Viral vector, we're getting, this is another one of the COVID. The Johnson & Johnson is a viral vector, right?
Correct. Johnson & Johnson and AstraZeneca, which I'm sure you've all heard about because other countries use that vaccine. And this is just a way, again, they use, this is, they've been testing and trying to make other vaccines out of, like Zika and Ebola vaccines. But they use a viral vector that then actually takes the particle in there into your system that allows it to be recognized and build an immune response. For example, they use the adenovirus as a viral vector, which is a common virus that doesn't cause disease.
And then diphtheria and tetanus are toxoid vaccines.
Right, it just uses a toxin made by the toxin, which is a harmful product, but it uses the non-harmful part of it to get the germ in to create the immune response, and that's diphtheria and tetanus.
So it is interesting, you know, there's always been lots of types of vaccines. There's always been lots of technologies used to make vaccines, but it is becoming a little bit more commonplace for us to hear about it from our friends, our families, and obviously you're hearing it from your patients as well. So just, I think in summary with these types, it's scientists look at how can I best activate a person's immune system? You know, what about that germ makes us sick? And what's the best way to activate an immune system to get that response and teach your immune system how to fight that disease and remember it for next time it sees it, so that next time it sees it, you don't have an immune response, which lasts for weeks or, you know, turns into a disease, and instead you just can fight it. So general rule number one, when we think about vaccine technologies.
Right, the more similar a vaccine is to a disease-causing form of the organism, the better the immune response to the vaccine. And that you can definitely see. That's why you see measles and chickenpox produce such really great immune responses, because they are live vaccines that can't cause disease, and they're very similar to the disease, the vaccine similar to the disease it causes.
So, because sometimes after a varicella vaccine, they'll get like a little chicken pox or chicken pox. What is the singular?
Chicken pie? I'm not sure. But that's why sometimes after the chicken pox vaccine, sometimes at the site, you may see a little pox or so. And that's just a normal reaction. And that's the body building an immune response. Same thing with measles vaccine. The first dose, 7 to 10 days later, you might see a slight rash and fever. Not contagious. They don't have measles, but the immune response resembles the actual disease.
Oh, looks like I didn't load the right poll, so we won't be doing that poll. But how many vaccines can be given at once? As many as you need. That's the answer. Yeah. So this is a huge rule. And I think even people in healthcare, I think don't, you know, we get nervous that you're going to give a kid 7 vaccines or something, but that's okay, right?
That's perfectly okay, because a kid breathes in many more antigens just by breathing outside with the pollen and the air and all of that than they ever get with all the vaccines administered at once.
Yeah. So, and a lot of times you're, especially from nurses and MAs, that the doc, the provider leaves the room thinking, okay, this child's due for 7 vaccines, mom's on board. And then when the MA or the nurse go back in to administer, then they find out mom's not really on board and doesn't want to give that many at once. So it's really important to remind them that it is perfectly okay to give as many vaccines that are due at the same time. And what is our next general rule?
So increasing the interval between doses of multi-doses does not diminish the effectiveness of vaccine. We all know that, because with HPV, I'm sure you guys see the same thing we do. Sometimes they get 3 doses over 3 years. We never have to restart. And once they finish that last dose, they're going to have great immunity. But decreasing the interval will decrease the ability of the body to build an immune response. So the problem is, as you give that first dose, it's working on building up its immune response. If you give the next vaccine too soon, then they sort of compete, and it's going to diminish the effectiveness. That's how I explain it to parents who don't understand why, if you give it too close together, it doesn't work. Okay, there are contraindications and precautions. So there are only 3 permanent contraindications, and we're going to go over this more in depth in 2 weeks. But pretty much there's only 3. And that is a severe allergic reaction to a vaccine component or following a prior dose, encephalopathy without cause after any diphtheria, tetanus, or pertussis containing vaccine, a severe combined immunodeficiency disorder, and that's only rotavirus vaccine. And then there's 2 temporary, which are pregnancy and immunosuppression. And pregnancy is not a temporary contraindication for Tdap, nor COVID vaccine. And immunosuppression for a lot of folks is temporary because once they stop the treatment or medication, then within a certain amount of time, they can get vaccinated.
And in 2 weeks, we're going to go over screening and storage and handling, screening, vaccine prep. So we'll go over all that in detail.
And flu for pregnant women too.
What was that?
And flu for pregnant women too.
So we've talked about types of immunity. We talked about types of vaccines, kind of reviewed some general rules for vaccines and why the schedule's made the way it is, so that you can get as many doses as are needed, and why different technologies are used for different vaccines. So ACIP, it's kind of funny that now everyone is an ACIP expert because this was not a new acronym for those of us that work in vaccines. So the Advisory Committee on Immunization Practices, they are the ones who write all of our clinical recommendations for vaccines and know all of the science about every single vaccine that is out there. So it is a panel of 15 experts, all different kinds of experts, and they meet 4 times a year, supposedly. That is not how often they've been meeting, as you know, over the last year. I think they're actually meeting today, aren't they?
Yes, they met yesterday about COVID, and they're meeting today and tomorrow about the other routine vaccines. So ACIP is who we look to about everything vaccines and what you can do in your office. They do not recommend alternate schedules. They recommend these schedules for different patient populations. And Macrina, on our evaluation, somebody wrote in that they have a hard time explaining to parents why the schedule is the way it is. So why they should follow the schedule in the first place? So usually what I talk about is the fact that I started getting vaccines 56 and 3/4 years ago. And when I found my immunization schedule a couple years ago in my mom's house, I discovered that I got DTP. There was no acellular pertussis at the time, at 2, 4, 6 months and between 12 and 15 months. So the schedule is this way because the schedule has been studied. Like Rebecca talked about, today the ACIP is meeting, and they are today going to talk about diphtheria, tetanus, and pertussis vaccine. They've been talking about that vaccine for years. So the schedule is the way the schedule is because they continue to study it. They continue to study disease trends, disease rates, infections. So that's why the schedule is the way it is. They've just studied it, and this is the way it works.
And I'd love to hear, I am going to pop up this poll because this one I did do right. So how often do your patients ask to use an alternate schedule? Is that something that you're hearing every day, only once in a while? And while they're responding to that, Macrina, just what do you say to parents if they come in saying, I got this schedule online and this is the one I want to use?
So one of the most popular alternate schedules is Dr. Bob Sears, and he will even admit that his schedule has no research to it. There's been no clinical trials, there's been no research, no study, no long-term studies of children immunized under his schedule. He just feels that by using the science that he knows that this schedule is more effective. A lot of parents pull up schedules that are online. may not be from trusted sources. Again, I just go back to the fact that this schedule has been studied, again, for 57 years that I know of, and that this is the most effective way to ensure that children are protected from communicable disease if to follow these schedules. And I use things like, for example, the meningococcal vaccine for adolescents. For the longest amount of time, we only gave 1 dose, right? And then as the ACIP continued to study the meningococcal vaccine and meningococcal disease, they discovered that at 16, kiddos should get a booster dose. So that's good news. That's proof that they study the vaccine and disease. And that's my reasoning.
Yeah. Yeah, and Lynn's commenting in there about that one of the things that makes it challenging is because of the school schedule, the school requirements. So people don't, they come in and not understanding why do they need to use the ACIP schedule when that's not what the school requires. So, I mean, I know we urge you all the time, but please just talk about the ACIP schedule with your patients, not the school requirements. That's what's clinically recommended. So, okay, so those are interesting results. So most of you only hear about that once in a blue moon. So, and here are all the older schedules, and I can testify that Macrina Leach has them in file folders all over her office. So
Yes, I am the historian of Maricopa County Department of Public Health when it comes to immunizations. And yes, I still have file folders.
Yes, she does. So nobody can know the whole schedule back and forth. And for those of you who are new to vaccines and you're like, yes, I've memorized it, I have it in my head. We hate to tell you it may change. New vaccines will get added. Ages will expand, which is great. HPV went from 3 doses to 2 if they got it before a certain age. This is the 2021 schedule, and what's missing from it?
Can I answer?
Yeah.
COVID vaccine.
So we know this is going to change
Yes.
because, so really you can't memorize these things. It's all they need to just reference the form, right?
Right. Even I, when I work in clinic, have to ask about Hib and pneumococcal, and if they get one at 12 months, do they need a second one, and what is the spacing from the second one? I need to ask a coworker. I need to pull up the schedule. Knowing that not everyone comes to us perfectly on schedule, you just sometimes need to pull that out and take a look at it. Mm-hmm. So just have one available in every room. Have one available where you draw vaccines, where you prep your vaccines. That is helpful as well.
And if you have questions about the childhood schedule, please chat them in and we'll make sure to get to them today. This is the catch-up schedule. This is not an alternate schedule. There's lots of different reasons why kids fall behind on their vaccines. You are going to be very familiar with this catch-up schedule this year because many parents, didn't bring their kids into your offices, as for their annual well visits, so they're behind.
Yeah, and this is just really a schedule on how do we get kids caught up as quickly as we can following the recommendations and the vaccine spacing. The one hint I can really tell you for kiddos that are really delayed, and I saw in the chat that somebody had just given 6 vaccines on 1 visit because the child was a little behind. I always then take a sticky note or take a piece of paper and I say, okay, today your kiddo got 6, but he's going to come back in a month and only get 2. So kind of make them feel like, usually with those really delayed kids, that first trip they come in at is really the worst it's going to get. They will routinely get less vaccines over time and routinely less vaccines on the next visit. So make them feel not so scared to come in the next time. I find that's really helpful in helping parents return.
Yeah, and I have another poll that's getting launched right now. We're curious, what strategies do you use to get patients back into the office? And it might take you a minute to read through all of those, but we do hope you read it because you can select lots of different options, and this will hopefully give ideas to some of your colleagues. And Felicia's saying on the reservation, schools are really good about their students updating their vaccines. That is great. Yeah, I think we're all going to have to practice about getting patients back in this year. I mean, every year it's a thing. Macrina, is it okay to give all other scheduled vaccines after getting one of the COVID-19 vaccines?
Correct. You can. Yes, absolutely. That was something the ACIP came up with. Oh, maybe a month ago, 6 weeks ago, when they brought the vaccine down to 12 years and up, is they actually said that they could co-administer vaccine at the same time. So if you have a kiddo coming in at 12 or 13 who's delayed, you can give them everything they need along with the COVID vaccine, as well as adults. If you have an adult coming in for a COVID vaccine and they need a Tdap, you can do those at the same time as well.
Yeah, so certain vaccines we don't give together, right? But
pretty much we can give all vaccines at the same time. It's just that there seems to be some spacing issues between live virus vaccines. You either have to give them on the same day or 4 weeks apart.
all right. So talk about intervals, and I'll give you like 5 more seconds to read that poll. But why don't you talk with us about minimum intervals?
Okay, so there are minimum ages to receiving initial doses, and that immunization schedule will definitely help you. You give them too soon, then the kiddo's immune system isn't ready to respond. There are minimum intervals between doses. We've talked about that. You can't give them too close together, but you can give them farther apart. There is a grace period, and that is 4 days. And that includes initial doses and the interval between doses. Again, if it's given shorter, even shorter, and that includes a 4-day grace period, it's an invalid dose and needs to be re-administered. But keep in mind that the minimum interval now becomes the spacing between the invalid dose to the next dose. I hope that made sense. If you give a dose of vaccine and it's invalid, you still need to count it from that date. The minimum interval starts. And again, we talked about it. Doses too close can reduce vaccine effectiveness.
All right, let's think about grown-ups. Anybody have any questions around that childhood or catch up or any of that? Can the grace period be used purposefully? For example, if a patient comes in 4 days prior to a minimum interval and we are aware of that, should they then come back greater than 4 days later?
So what we do is that if for some inadvertent reason a kiddo comes in and it's within that 4-day grace period and you don't think you're going to get them to return, then you can administer the vaccine. We administer the vaccine within the grace period if they're not going to be in town, if they're going to be on vacation. So there are days where you can use either your provider or in discussion with your provider can make the judgment that it's perfectly okay to purposely immunize within that 4-day grace period, if you don't think you're going to get them back, or if there's some extenuating circumstance.
And we do administer live virus vaccines and COVID vaccine at the same time.
Correct.
Okay.
So the adult schedule, I really like the adult schedule because adult vaccines are a little different. Children are recommended to get pretty much everything. Every child's recommended to get all of the routine childhood immunizations. But when it comes to adults, things are a little bit different. And there are some medical conditions or chronic conditions or other conditions that may make your adults more at risk for certain diseases. And so those vaccines are recommended. So this will actually help if you know that you have someone who is pregnant or is asplenic. It will really tell you what vaccines you need to focus and they need to get to remain healthy. So this schedule really comes in handy. And it actually comes in handy when you're trying to explain to your patient or client why it's so important they get that vaccine.
Yeah, and it looks like about 5% of folks on the line now might be are calling in patients with particular medical conditions, you know,
Oh,
so
good.
reports to see what they're due for. So that's great.
Oh, good. And I think it's real important because more and more adults, you know, we have adults with asthma, with diabetes, and they don't necessarily see themselves as having a chronic medical condition. So they live with it and they live healthy with it, but we're the ones who need to make sure that they recognize that they need these vaccines to remain healthy. Oh, and then we have the vaccine schedule broken down by age, which is also really helpful.
Okay, so what are your tips, tools?
Okay, so first of all, you need to have a calendar available in each exam room. And I always recommend that you have a calendar for the previous year and for the future year. For example, we have 20, 21, and 22 calendars because we're going to be scheduling patients out soon, 6 months out or more. So just make sure you have those so you can count the weeks in between the vaccines because the minimum spacing is by weeks. And check the age of the kiddo. We have a lot of parents who will put 1 year down or will put 12 years down. But when you look at the age, they're just a couple of days before or a week before. I've discovered that routinely kiddos that are 11 months of age or older, parents kind of think they're 1 year old and they're not. And same with COVID and being 12 years of age, they think 11 and a half is 12, which it's not. So just double check that. I don't want you to get stuck like a lot of us have been.
And we have lots of calendars, and Amy, I know we talked about getting patients back in a little bit too, so that you can keep them as close to that schedule as possible. We have resources for that. We have calendars. If you go to whyimmunize.org, you can
it may take a couple minutes, but
you can actually order these things and we will print them in fancy colors, which maybe your office manager or your doc, or maybe you're not allowed to print in color at your office because it's more expensive. We'll send you bright and shiny colorful ones. So please order those. And Barbara has a resource too in the chat there. She's saying there's a CDC vaccine schedules app that you can get on your phone that has all the information on guidelines and conditions, and it looks like it has the schedules built in. That's pretty cool. All right, so let's talk a little bit more about reminder recall, and Maggie Macias from ADHS is on the line, and I'm going to stop sharing my screen because she is going to actually share hers and show us how to use the ACIS reminder recall. She's not going to spend a ton of time on it, but Maggie, just so you know, we did a poll earlier and 27% of them are already using ACIS reminder recall, and another 22% don't use ACIS for reminder recall, but they use some other system for reminder recall through their EMR or something like that. So that's great, but show us how to use the ACIS one. And you're gonna have to unmute yourself too, Meg. We see your screen, we don't hear your voice. And we still do not hear your voice. Let me go to.
Can you?
Oh, there we go. Oh,
There we go.
heard you and then you left again. So unmute yourself. There you go.
Can you hear me now?
Yeah, now-
I'm sorry. All these screens and trying to find the unmute button. Hello, everyone. My name is Maggie Macias, and today I'll be presenting on reminder recall. We'll just go through it briefly. As mentioned, you guys are already using it, so I'll just give a little refresher how it works and what it is. So the reminder recall is a tool providers can use to identify patients who are due for vaccines or past due. Providers can also or schedule patients based on the list and create letters, postcards, or mailing labels. How to access a reminder recall: log into ACIS. If you do not have access to ACIS, you're more than welcome to call the ACEs help desk for a login to ACEs and the permission to have reminder recall. The reminder recall, when you log into ACEs, is located on the left-hand side tab, reminder recall. You'll want to go ahead and select for all patients. Do now does default. You will have the option to do 3 months or more past due, or due in 1 month or less. You can select the option that you would like here. When selecting your parameters, you want to make sure you have the correct organization listed here. You want to make sure that you have your patient age range, your date of birth, and then you will select your parameters. You want to select the vaccine you would like to include in the reports. This is just an example here. I selected 431331 for series. Once you select that, you want to make sure you select due for all selected vaccines. Again, it's telling you the vaccines that you are selecting here on the right-hand side and on the left top side. You'll want to select generate patient list. This will then navigate you to selecting if your patients are no longer active within your facility, you have the option to inactivate them here by selecting the drop down. Before, you would have to go into the patient's demographic individually one by one, but now with this new update, we can actually adjust it all here within one page. And here it's just telling you that this patient has an address, mailing address, a telephone, and a cell phone. And then we will submit. I like to recommend to export the patient list so you can compare it to the PDF format. It's a little different. Some prefer the exported list versus the PDF format. And here you can see the numbered icons indicate, or lighted in green icons indicate the number of patients and ACEs for your organization, how many addresses you have available to you, how many telephone numbers you have available to you, as well as cell phones or emails. You can also generate this list from here. You can also print the labels, the letters, generate the mailing letters, create postcards, send emails. This is a very helpful resource. If you want more in-depth or more resource regarding reminder recall, we do have IPO Train. In IPO Train, we have ACEs Reminder Recall, which goes more into details for specific series and specific vaccines. And again, I have the actual enrollment key here that I can put in the chat as soon as I end the presentation. And everyone is more than welcome to access our IPO Train. We do, again, have helpful resources here for the reminder recall or other trainings. Here are some emails available to you if you have any questions regarding dose accountability, interoperability, training, and if you need to contact us for any other questions, here is the main line. Thank you so much. I hope you guys have a great day.
And we have a question in the chat about whether they can do this for COVID vaccine. Can they?
They should be able to do it. With the upgrade that we have now, COVID-19 should be there.
All right. So let's see if there's other ones. Oh, I don't think anything else. Will this run all patients or just VFC? Was one of the questions, Maggie.
All patients that are in ACEs, as well, being mindful that sometimes the contact information can be inaccurate if the providers remember, ACEs is pretty much the information that you put into it. So if you don't update the contact information, the contact information won't be correct in the reminder recall. And they said VFC, well, if they're 4311 series, it's going to be for specifically for that series, what they're running for. So it has different selections there
All right.
in the parameters.
Well, thank you. Yeah, I'm sure we'll be talking a ton about reminder recall. I want to make sure we're kind of nearing the end here. I think we've reviewed everything about the schedule, how to help people keep folks on the schedule, but we want to make sure, because we still have a couple minutes left, that nobody else has other questions. So if you want to unmute yourselves and ask a question, you can do that, or you can put it in the chat.
This is Jackie. I had a question for everybody. Has anybody had a chance to use the new ACIS upgrade? That was the first I've seen it. It looks very different and pretty. I like the purple. Maggie, is it officially on everybody's account now?
May have been using it. It is very cool, Sam says. So there's a question on there. So reminder recall and ACIS, is it that just to get a list of patients and then you contact them? The ACIS, the reminder recall and ACIS will contact patients for you, or do you have to contact them on your own, Maggie?
No, you have to contact them on your own. It's just giving you the tool to send out those, print out those labels, send out those emails.
Okay. So it gives you the information. And remember, for many of your patients, they're getting vaccines in other places. So, you know, when they're due for something and the school tells them they need to go in, they go to their county health department, or to some, you know, a baby shot pop-up immunization clinic or something like that. So that whoever vaccinated that child last may have the most up-to-date cell phone number, because we know that those change a lot. So. All right, well, next week, we can hang on for a few minutes after we close the line too. So, all right, 2 weeks from now, July 8th, we will all have had a good 4th of July, hopefully. We're gonna talk about cold chain. We're gonna talk about screening patients and vaccine preparation. And then July 22nd, that's when we're gonna talk a lot about empowering patients, you know, how do you have those hard conversations? So we know that a lot of you that log on are here for vaccine information, and some of you don't actually administer vaccines. You know, you work for a childcare center that hosts vaccination events maybe, or some sort of other community group. Please don't miss the July 22nd one. That's the one that we really need you at next week. You're welcome to come, but we're going to be talking about temperatures of refrigerators and things that you might be a little confused about. But we are really looking forward to seeing you all in 2 weeks. Thank you again for everything that you do. You are really saving lives. We're so glad to be a little part of it and helping you learn from each other. So thanks, everybody. And if you want a prize and you didn't do it already, chat me your address. So. Oh, did we put the evaluation link in the chat? Yes,
How
we
do you
did.
get onto the post test?
Yes, so the links for the post test is in there, and you'll get emailed that as well. All right, not a lot of questions here. I think we got through all the ones in the chat too, Macrina.
I think we did.
Yeah.
But I'm telling you, I'm blown away from that change to ACIS. It's been so many years that it was the same thing. I kept double checking.
Yeah. Things change, Jennifer.
I guess so, but that was a long time coming.
Should learn. I'll have to see if that's what we ran, because we just recently here at Maricopa County ran a list, and we have a call center who's making phone calls to our kiddos who are going to be our 11-year-olds.
You probably got it from,
We ran it about 2 weeks ago, so maybe we did use a new one. I don't know.
yeah. Because you're not electronic yet, right?
Nope, we're old school, just like my file cabinet.
No
With my file folders.
I talked to somebody once who said, well, I created the original, it was a rural doc. I created the original vaccine registry. It was a lot of post-its. So
You know what is funny is when people start to complain about technology and how long it takes to do certain things, I'm like, oh dude, come here. Let me show you transparencies. They look at me like, what is that? Yep. Sometimes it's kind of cool to say that stuff.
all right, well, I think we're good to log on off.
Bye, everybody.
Bye, everybody. We'll see you in 2 weeks. Thank you.